right, everybody. Welcome back to another episode of the 360 podcast series. You like that cool music that we have for the intro there. My name is Ed Masterson. I'm the host for these episodes, the 360 podcast series that we do. It is sponsored, as you can see, by 360 Executive Suites and Mr. Fred Arnold. Fred, we are coming to you from the podcast studio in one of Fred's 4 locations here in Santa Clarita. This is the location at 25101 The Old Road. Also in this building, don't forget, and if you're not aware of it yet, there is what's known as the New Home Center up on the 2nd floor of this building. At the end of this episode, we'll put up some contact information for you to get in touch with Fred and his team. You can make an appointment to drop by here, check out the New Home Center. Also, if you are in the market for a business home away from home, an office space that you'd like to have, Fred has 4 state-of-the-art properties here in the Santa Clarita Valley. This is one of them here, the old Remax building on the old road, but 3 other spots as well. Great collaborative spaces, lots of great relationships that get made from the different companies and providers who have space in Fred's buildings at his 4 different properties. So check that out. Like I said, we'll give you some contact info at the end of it. And with that, I'd like to introduce my guest for today, Mr. Alex Gelfand. He is the co-founder of the Los Angeles Medical Imaging College. Really happy to have him on the show. Alex, thank you so much for making some time for us today, and welcome to the 360 podcast series.
Hello, everybody.
Good to have you with us. Tell us a little bit, if you don't mind. I was looking up some of the stuff about the college, but why don't you go ahead, if you don't mind, tell us about the college, a little bit about it, how you came to be a co-founder of it and stuff like that. Kind of an overview so we get a good feel for it.
Got it. So in 1998, I started my journey, my interest in becoming a sonographer. I had some personal health issues which nobody can figure out, and I was 19 at the time, and my grandma literally drags me to a bunch of different doctors, not even knowing what an ultrasound is. I ended up getting an ultrasound, and they found a lump on my liver which caused some of my health issues. One of the coolest things of that experience is that the sonographer who performed my exam, the ultrasound tech, before even the doctor was able to, even though he wasn't supposed to, tell me that it was nothing to worry about. Almost, he said, to get it biopsied, to obviously check it out. I do need to change some things in my eating habits, but it is not something I'm going to die from, which was obviously a very big concern for me at that time. And it was the coolest thing to me. When that experience happened, the doctor walks in, kind of goes over everything. And I remember driving back home and thinking, oh my gosh, how does this ultrasound tech, this sonographer knows before the doctor is? And my kind of life switched. 3 months after that, I was enrolled myself in an ultrasound program, which wasn't great, but I do become a sonographer. And I was a sonographer and ultrasound tech for 12 years and loved it. And then slowly, as we all do, started looking at other ways or pathways or keep myself motivated and busy. I started working at a school, and I loved it. I think that was my second time falling in love with sonography or again, now, but from a different perspective, now that I was older, to be able to share my knowledge and see a student that walked in, and knew nothing, like myself, knew nothing about ultrasound, and 21 months later, having an amazing job, after externship, after learning all about it, and was able to change other people's lives. So I worked at a couple different schools. I stayed in a very large school in LA for 14 years before walking away and starting our own school here downstairs. LAMIC, or LA Medical Imaging College, is what we called it. We're applied to be a non-profit school, and that's our goal. I think my personal goal is to continue doing the same thing, working with students, literally walking with them from day one through the journey of becoming an ultrasound tech, a sonographer, whether it's vascular, cardiovascular, OBGYN, whatever it is. I think it's awesome. So that is our goal. That's what the plan is for LAMIC, for the school in the very near future. We are looking to be a 2-track program, which is kind of different from other ultrasound programs out there, where the student would be able to choose whether they are general sonographer, which covers OBGYN, abdomen scanning, breast, small parts, they call it, testicles, and so on, or becoming a cardiovascular sonographer, or scanning the heart, veins in the neck, carotid arteries, veins in the leg for lower extremity venous, for blood clots, and so on. So there's so many different things that they can do, but we are looking to be a 2-track program by the end of this year. Yeah.
Wow. So that's a lot of great information. So all the different, I think you covered one of my questions I was going to ask you about, all the various specialties or things you can kind of, like you mentioned, all the different parts of the body that people maybe specialize in as a niche kind of skill set to do that. What is the, for example, when a student would enroll in the school, how long, and when you say a 2-track, what does that mean? Can you explain that to me?
So the student, both programs, both tracks are 21 months, where the student would do the didactic on campus, scanning in labs here for 15 months, and in the last 6 months or 960 hours are at externship. It is an AA degree, so the student would start off with their 3 months of GE courses, then learning about ultrasound physics courses, and then choosing, again, becoming whether to become a general sonographer,
right,
which will get you abdomen class for 3 months, OBGYN class, and a vascular class, or you can choose to be a cardiovascular sonographer, which will then give you a vascular course and then 2 cardiovascular classes, and then 6 months externship at the end. My experience and what I'm seeing is a lot of female students will get into the general sonography, OBGYN, breast, small parts, and a lot of guys will go into vascular sonography. Of course, there's many different, you've seen women do that, you've seen guys do OB, but in general, that's the way it's been. If I'm an OBGYN doctor, I'm not going to hire a male to do transvaginal or invasive ultrasounds.
Right.
So it doesn't make sense for guys to go into OBGYN almost, but yet they do. There are a lot of specialty guys that will go into it, whereas a lot of females will go into that one, and a lot of guys will go into cardiovascular because you're moving patients, you're transferring patients a little bit more with the legs. They're not mobile at times, so a little bit more movement. So that's kind of the trend I'm seeing, but those are the 2 tracks that you'd be specialized in.
Okay. No, thank you for that explanation. So if I was going to become a student and pursue this as a career, even though I know you kind of mentioned all the various nuances there between the tracks, if I wanted to ensure myself the best opportunity for employment, would it make sense I take both tracks and become good in everything, sort of? Qualified in everything?
So yes and no, but what I'm seeing is more and more every year, more hospitals doing more exams with ultrasound.
Okay.
Therefore, there's, I hate to say it, there's enough for everybody, so to speak. I would concentrate at one at a time. I love the question. I love the idea of like, hey, I want to do it all. I want to do it everything. At the same time, you would concentrate on one, become an amazing OBGYN abdomen sonographer. Then maybe if you get bored in your career, which you shouldn't, 10, 50, you can then learn vascular and so on. But I haven't seen that happen. Believe it or not, a learning curve for a sonographer is 8 to 10 years. So they say you're not going to get bored for the first 10 years, and then you're going to be overwhelmed by the set. So I think one at a time is my answer to that. But hey, I'd love it. I would. Hey, if you get bored and you want to do cardiac, great. Yeah.
But if you get specialized in one of the tracks, for example, how tough is it for new people just starting out? Like, if I'm a student and I complete the track and I've got all the credentials that I'm supposed to have and I got the AA certification, how tough is there a market out there now? Is there always not enough of people in this field? Like there's always a demand for them, yeah?
It seems to me, again, I've been doing this for a little bit, 22 years. Post-COVID, I've seen a boom in sonography.
Okay.
Even though, I don't know, I mean, we don't see lungs, sonography does not, we see soft tissue organs, but I do see almost maybe some of the older sonographers were forced into retirement. Some people didn't want to get the COVID vaccine, but I've seen a boom. I've seen, again, more exams being ordered, more licenses, meaning 2 years ago, you wouldn't do a musculoskeletal ultrasound. Like if you had a bone tear, like you wouldn't, but now they're doing them.
Okay.
That's its own specialty. It's its own license now. So more invasive procedures. They're using dye in sonography. Cedars-Sinai bought a first automated breast ultrasound machine. So there's movements in the field, and there's always like it's constantly evolving, and I think there's a good demand for sonographers right now.
So I'm gonna list off some of the things I've had wrong with me, and then
Okay.
you tell me if these things
Okay.
were the people that did these for me. Because
Did they
in my
mess it up?
no, not at all. No, they were great. But I kind of in my mind before speaking with you didn't realize all the sort of specializations. I was in my mind just thinking of as general X-ray technicians. So for example, I got bad knee, so I had a knee replacement. So I've had a bone scan on that 2 or 3 times since the replacement is still not quite right. So bone scan, and then MRI, and then traditional X-rays if you go to the doctor. Those would all fall under the training that we're talking about, correct? All those things?
We specialize in sonography, which is ultrasound.
Ultrasound, okay.
Ultrasound, which is sonography, which is general tract, abdominal, or cardiography, or cardiac ultrasound, they call it. But that's what it's specialized in. X-ray is a shorter program. You don't need to do 21 months. You can do CT probably about the same time, but we specifically specialize in ultrasound. And that's where I'm seeing the most growth.
Okay, and that term sonography, is that connected somehow to the word sonar initially?
Correct.
Yeah.
We're sending sound waves into the body.
Okay.
As it travels through the skin, it touches the organ, let's say a liver, it bounces back and gives me an image.
Right.
By how long it takes for that bounce back to happen, the machine knows where to place it on the screen.
Okay.
Therefore, it's non-invasive. Therefore, we're using sound to look not like a magnet. No, there's no radiation, no damage to me as a tech or a sonographer or the patient. That is why I want to say the first line of defense. They will do an ultrasound faster than any other imaging. It's inexpensive, but also non-invasive. And you can do 10, 20, 30 ultrasounds a day. You can't do that with MRI, and you shouldn't. Yeah, it sounds like you've had one too many.
No, I've had a lot of MRIs, a lot of bad injuries from running and stuff like that. So when did sonography become a technology that started to become popular in the medical field? Has it been around forever, or it's more of a recent type of thing?
I mean, I want to say fairly recent. The first ultrasound happens in 1976.
Okay.
And I know that because I teach the history of sonography class. It became only for OBGYN. Actually, the guy that started using it for cleft lip and pregnancies, that used the first, his last name McDonald, yeah. But he was the first guy that actually started using it for pathology. They were using it before just to look, just to practice. From 76 to 80s, not much happens. And then in the 80s and 90s becomes very popular with pregnancies.
Right.
96 is when they started using it for vascular ultrasound.
Okay.
And then cardiac, and now MSK, and now breast, and now testicular ultrasound, and now abdominal aorta aneurysms are checked with ultrasound. And the fastest way to check for a blood clot is to get what they call a ELAV, lower extremity venous ultrasound.
Wow, that's amazing. Yeah. So, yeah, you're right. I mean, relative to the field of medicine in general throughout history, 1976 is fairly recent, right? Yeah.
Yeah.
So, and do you ever use sonography in the head area as well to check for things?
Which is, again, one of the newer things. It's called Transcranial Doppler, or TCD, they will look to the tiny holes in your brain, because we don't see bone, and sonography or sound does not go past the bone. So we use these little windows, transtemporal windows, transoccipital windows, also through the eye, which is transorbital windows, where I can put a little probe and look through the brain, especially concentrating on the circulation in the brain.
Wow.
That is very new. Actually, only a hospital that would be like a brain or a heart specialist doc would only have, not even every hospital has that equipment right now.
Right.
Yeah.
So if I, for example, have swelling in my knee, sonography could look at some of, not the bone part,
Correct.
but the
the actual fluid, what it's made up of.
Right.
And a lot of times your doctor at that point will go in and do a biopsy or try to take the fluid out. And that's 99% of the time these days are going to be done ultrasound guided, where an ultrasound tech comes in, you'll put the probe or the little, thing on, and they'll see the needle pop the little balloon, make sure there's no more fluid, and then they leave. It's an ultrasound guided aspiration.
So
it happens every day. Yeah.
Wow. In the old days, were those aspirations done without the assistance?
Blind.
They just had to kind of feel their way through it and take a guess and get it. Wow. That's amazing then to have the sonography guided, right?
Yeah. And if you come back next day and your leg is black, that means they didn't do a good job. That means the blood spilled. And that's how they really check. It's like, all right, put some ice on it. That's really how they would do it, or come back, try it again. But that is how they did it. So I had my biopsy of the liver, 1996, I'm going to say. They gave me a towel to bite on because they said if it might be painful.
Wow.
And then I thought to myself, oh my God, this is what, but yeah, that's what they did.
So just like in an old cowboy movie, they said, here you go, Alex, bite on this towel while we probe.
If we mess up.
Man, that seems pretty tough in the 90s, right?
Yeah.
Or that you would think, wow.
Yeah, you think they'd have something. I mean, they do localized where they the liver, now that I learned sonography, is so deep in there that it would still hurt, and it was obviously discomfort, and they do misspoke and stuff happens. So yeah, they give you a towel, grab your mom's hand. I'm 19, but grab on something because just to be ready for that shock.
Wow, that's amazing. So with the advent of sonography playing a bigger role in medicine now, it's created lots of new careers for people going into that field. Did it eliminate any old careers or not really? It's just enhancing all the existing careers that used to be out there before, right?
Brand new.
Yeah.
And again, because it did like 10, 15 years ago, a large ultrasound department would be 4 techs. Now it's 12 techs because more and more exams are being ordered, more and more lower extremity venous ultrasound. Ultrasound, as it becomes popular 70s, there was no ultrasound schools like LAMIC. So what actually happens is all the x-ray tech were just said, hey, you are now an ultrasound tech.
Okay.
And they all said, what the hell is an ultrasound? And then let me show you. And they had a thing called see one, do one, teach one, is what they really, how ultrasound schools come about. It wasn't until I think 90, which is 20 years later, there was a first ultrasound school.
Wow, that's amazing. So this school that you have then is kind of really invaluable to this region that we have here, right? Because I know your office is here in Santa Clarita, and then do you get applications? So, earlier, I'm sorry, I wanted to ask you, you mentioned a thing called an externship. Can you explain to us what that is?
I hate to say it, but it's kind of like free labor. As you are 15 months in school and you're doing your classes, you're coming in here and scanning and practicing in each other, which is great, but that really isn't the real world. That's not a hospital or imaging center experience. Once we prepare you for externship for the last 6 months, you go into the field and I don't want to say volunteer because it's part of your school, but you must complete those hours. Not only observing, but we want you completing exams under supervision of a licensed sonographer. And you will do that for 6 months before you can get your diploma and start applying for jobs. 6 months going to feel like a lot. 900, it's full time, 8 hours a day, 40 hours a week, 6 months. You're going to feel a little bit more ready. You're still not going to be ready for the real world, but we will get you as close as possible to get a job. Some students still end up volunteering, doing a little extra hours, which is okay. But you're going to work pretending, we call it sonographer in training. Don't say I'm a student because people say I'm a sonographer in training, and you're doing the same exact things without being paid for it. And somebody's constantly observing you and evaluating on a monthly basis.
Okay.
Once we feel like you're ready for the field, you get your diploma, and hopefully a job will follow.
So you mentioned the concept that I think is true in a lot of professions, which is training under, kind of a controlled environment, like in a school, and then you go out into the world dealing with other elements. What's the biggest thing, whether you've been doing it forever like you have and you're super expert at it, or a brand new person going into the field, what are the biggest challenges when you start working with real patients out in the world?
I hate to say it, like sonography, learning ultrasound is pretty easy. It's the patients that are difficult. Someone, when I was in school, told me, a hospital job is full of human experiences. And I'm like, well, that's pretty vague. And then I learned, what a human experience is. When your patient's aggressive, when your patient doesn't smell great, when your patient is a homeless person, which again, you have to give him the same respect, the same as everybody else, but he doesn't really want to be there, or he or she, so it is a tough, it is, you have to be that professional and just keep reminding yourself why you became a sonographer in the first place. I do want to help people. Hey, I want to save your life. Please bear with me. Please be patient. I promise you, this is the least painful exam you're going to get here at this emergency room today. But that's probably the biggest challenge, is that being able to be ready for whatever walks in or rolls in or gets brought to your room to get an ultrasound, because every night's different. Every single night's different.
I guess it is kind of cool if you are a sonographer to say, hey, you know what, my procedures is the least annoying thing you're going to have to deal with today. So
that is what I would say, because let's say I'm ruling out a blood clot. It's either that or like an X-ray where you have to lay still. Most of them will not. Or you're going to get poked, get your blood drawn. We call those guys the vampires, the MAs. So I put a little gel on you. I mean, if you've had an ultrasound done, I press a little. Yeah, it's a little discomforting. Trust me, it is the easiest. And again, no radiation, no damage to either one of us. That is the easiest thing we're going to do today. Yeah.
Is there any kind of sonography that is used as an application in dentistry nowadays?
So they tried, but no, not really. They are using it in like your eye doctor or optometrist, as we are able to, the same transcranial Doppler can check the pressure in the arteries that are supplying the blood to your eye,
right?
Which is like no other exam can do. And if there is pressure, or if somebody's got hardening of the arteries, diabetes, sometimes we can use that equipment to determine, being it non-invasive.
So I'm intrigued by this thing about being able to check for blood clots and things like that. So sometimes, am I correct, swelling in a joint or something like that might be because blood flow is being restricted somehow, or there's inflammation. So the sonography process can ID that, right?
Instantly.
It can see if there's some kind of constriction in veins or something that's keeping blood flow from going back and forth. Correct. So if somebody feels fairly okay otherwise, but they have swelling in an ankle or a knee or something like that, can they just make an appointment with a sonography location, or they have to be referred for that through a doctor of some kind?
Unfortunately, the way our insurance is, you do have to be referred. If you are like everybody else, go to Dr. Google, my God, my leg is swollen. It's hot to touch, and it's only one leg. Yeah. And I'm having run to ER, because then they'll order it instantly and you'll know right away. A lot of times with a blood clot, your doctor's appointment, which is 2 weeks later, you won't make it. I mean, I'd hate to say. So when I was around 18, my 41-year-old, my dad's younger brother, didn't wake up from a blood clot.
Really?
He was he traveled to Portland, which is not a long flight, but you know what they tell you? Walk around, stretch your legs in the long flights, because that constricts your vein. He wasn't feeling well, and he did have some leg pain. He was with his business partner,
right?
And he said, they went to separate hotel rooms, and he said, I'm going to go to sleep. I don't feel good. And this is early, from 9 o'clock. Next day, the guy knocks on his door, my uncle's, from a blood clot.
Wow.
41. I'm 47.
Wow. Now I'm scared, because my knee is swollen, and it's always kind of bugging me, and it's not quite, come around as well as it should have with all the PT I'm doing on it. But that's good advice, though, for people to, at least in general, I think you would say, be mindful of your own health. Correct. And not, put things off.
If it's red and hot to touch, that's blood pooling in your leg.
Right.
Yeah. And it's warm.
Okay.
Yeah. It's a big sign. I mean, if one person's watching out there and goes, oh my God, and runs to the doctor, we did our job today.
No, you did, because you've got all the great knowledge. I love it. Yeah. where do you find your students, the students that are showing an interest in wanting to come to the college? Are they, I'm assuming nowadays some of the training can be done online, even if they don't live here geographically in California. Is that right?
Correct.
Yeah.
So sonography, with that being said, sonography or ultrasound is very hands-on experience. So yes, our lectures are online, but our labs are downstairs. I have 2 machines in my office
that's
already.
great. That's really
Eventually have 3, and we would have up to 10 students per class, even using one of the larger rooms, the room downstairs, if I get more students. But the labs are in person with my hand or instructor's hand on your hand doing the scan. So we get people from Sun Valley, from Topanga, from Palmdale, from this whole area, from Valencia, obviously, getting students everywhere. Because we're a fairly new school, we offer more. It's less expensive.
Right.
And people are willing to drive and already put themselves on the waiting list as we're opening at the end of this year. Yeah.
That's great, Alex. I think, again, every time somebody comes in for one of these interviews, I learn so much, and hopefully the people watching the episode do as well, because, members of the general public who have no clue about your world and what you do day in and day out, it's always great knowledge to have that. And I think it's great that you're providing opportunities for, and I guess it's not even, I was going to say young people, but it could be people that are changing careers too, right? That could get certified and go into that career and find a new job that they may love.
Yeah.
Yeah,
What I'm seeing, and I love to see in a student too, if you're a medical assistant or a CNA or even a vet tech and working with pets, just kind of progressing your career and moving into sonography. Usually those students, because they've already had some interaction with patients, because they're more successful, more likely to be successful, and usually will do better. Because all they have to learn is the scanning part. They already know the patient part. So I encourage those people. Also, veterans in general, our school, support veterans in general, and we have a discount for. So if you're a vet, usually you're really good at kind of breaking things down, having a good routine, which is what it takes to be a good student and a good sonographer and successful at anything. So we do welcome veterans, definitely.
That's great. Yeah, and we do have a big veteran population here in Santa Clarita, which is really nice that you guys do that. There's also, and you mentioned the veterinarian thing, so that sonography is big in the veterinary world now, yeah?
The big licensure for sonography is ARDMS, or American Registry of Diagnostic Medical Sonography. I know it's a mouthful, ARDMS.org. But they're having a license to become not a human sonographer. It's going to be a special license that you'll be getting, which makes you legit, makes you official, and you'll be a pet sonographer.
That is great. No, because you're right.
Really cool.
We all know our animals are part of the family, right? So it's just like taking another regular member of the family to a human doctor, of course. Where do you see the field going? Like from, you've been in it for a while, so you have a really good feel for it. You're helping now to contribute and train some new leaders in the field like you've been doing. Where do you see the field going? Is it just going to keep expanding, and will there be new applications for sonography that you haven't quite identified yet?
So, yes, I think both will happen. I think as technology is getting better and our machines are getting better, even the last few years, we can see things now that we didn't see 5 years ago, as little as 2 millimeters tumor and the head of the pancreas can get you, and yet now we can see it. They're using what they call elastography, kind of instead of a biopsy, where we, with ultrasound, would be able to tell how elastic something is. And what they've learned is if something is really dense, a tumor, let's say, is dense, right, then there's a much higher chance of it being cancerous or malignant. If it's hollow, if it's fluid-filled or not as then there's low chances of it being, it's probably, not cancerous, benign. So we, with ultrasound, without having a biopsy, should be able to tell whether something's cancerous or not. Right now, we don't. We suspect, we think this looks this way, but you need you need to do a biopsy and so on. So I think eventually we sonographers would be the ones determining whether it's something on the spot.
Right.
On the spot.
Right.
So I know it's going to take some years, and I know we're going to make some mistakes, but that's the way it's heading. Also, like injecting dye in a human, still scanning the liver. What you will see is with ultrasound, the tumor that's cancerous or malignant usually will light up, where one that isn't. So they are looking for ways to use sonography in more ways than just liver scan, gallbladder, and so on. So I think that's where it's going.
Well, it's amazing to me that you can now, just the example you just gave, being able to potentially ID a cancerous tumor without invasive procedures versus before you would have had to somehow get in and take some of that tumor and test it, right? And you could at least give a better potential initial observation of it. Do you think, I know it feels to me like the sonography thing is mostly helping to identify things and being a secondary piece to some additional medical knowledge as well. Is there any kind of therapeutic application? Like, is there anything about sonography that provides therapy to like muscle or soft tissue or anything like that?
Yes, short-term answers, yes. Your chiropractor probably has rubbed some gel on you and it made you feel tingly, right? So they're using a super high frequency ultrasound to heat your body just by a few Fahrenheit, just a little bit, which relaxes your muscle, opens up or vasodilates, opens up your vessel, and moves more oxygenated blood to the area, which is the healing effect. That's what it's doing. But it's not the same as imaging or diagnostic sonography that we do in a hospital. We actually use low frequencies, like 2 megahertz. They use high frequencies, 20 megahertz and so on. So yes, it's the same, but no, it isn't. In diagnostic, we use, again, low frequency, which does not have a healing effect, just a diagnostic or visual, I guess.
There is a machine they use on me periodically at PT. It's a laser.
And it's awesome.
It's like a laser.
It's a high frequency ultrasound.
They move it around on there. So
I bet you next time you ask them about it, they'll tell you. It's the same idea. It's sending high frequency sound into the muscle that they're doing, whatever, your knee, that relaxes it. And again, vasodilates, the vessels open up, more circulation to your knee, and that should make you feel better.
Wow, that's so amazing.
But it's sonography, it's same ultrasound.
That's what an interesting field. I mean, again, really cool. Most of us probably are not aware of it, except that they see in a movie checking for babies, and all that kind of stuff.
Like myself, like that's again, like even guy. A lot of times, what will happen is a female student walks in interested, and then a guy or her boyfriend or husband is like, "Wait, you do ultrasound for veins, for heart?" Right. And I'm like, "Yes, I did not know that either." You do it for 9 other things. There's 9 licenses or 9 specialties that you can get by ARDMS to do ultrasound.
Wow. Yeah. So then, if I come in and I'm going to specialize in one track, you probably already mentioned it, but sorry, is it 18 months, 2 years, like for me to complete that and get
21 months?
21 months.
Correct. 18 months is the core, 3 months is the AA degree or G courses.
And contained within that 21 months is my externship time as well?
Correct.
It is.
15 months didactic or classes, 6 months externship at the end.
And then, again, nothing specific, not trying to hold you to that, but just for people that might be interested in that field, starting out, an entry-level spot, once you have all the training and you're ready to go out, is it something, or is there a range of salary that's kind of recommended? Are those positions in the medical field, Alex, regulated by prices that people have to make, or it's just sort of each organization pays what they pay type of thing?
It's very vague. I want to say a newer sonographer will make $30 an hour, let's say, start-ish, whereas someone with 5 years experience would make $90 an hour.
Oh, wow.
So it's so huge. The gap is really big. Working at a hospital will get you the 90. Working at an imaging center, 9 to 5 probably will not. So it really depends where you are. I know a lot of my students have moved to other states. Portland, close to $100 an hour.
Really?
Kansas City, $70 an hour. So it also depends on a state. If there's many ultrasound schools in that state, like in California, you're looking at 30, but Kansas City has 0. Every sonographer in Kansas City has to come from another school or another state.
Yeah.
They'll get a lot more.
Wow.
Traveling positions, take those. Get a little bit of experience, get a year under your belt, then go to UCLA or USC, make that $90 an hour.
Are there any medical, there's this group, I hope I'm getting the title right. They made a movie about it one time, Doctors Without Borders, that travel to countries where there's things going on.
There is.
Is that a specialty for sonographers? They can get on board with a group like that and travel the world going around helping out people?
Yes. So besides American Registry of Diagnostics, there's Society of Diagnostic Medical Sonographers, or SDMS, and they actually do that. They will go to other countries, not only train. Sometimes a sonographer can go and train a doctor in Uganda how to perform an ultrasound. So there is ways to get yourself involved. Again, if you are an ultrasound tech out there, go to Society of Diagnostic Medical Sonography. They have a tab on volunteering, and you are able to do help people in other countries, even here locally. Sometimes they'll go to Skid Row and do pregnancy ultrasound, stuff like that. I recently volunteered at Glendale Memorial Hospital at Queen of Hearts events. It was for the local people to check their carotid arteries for plaque for free. They do that every year. There's so many ways you can donate your time and your skill as a sonographer. If you just look into it, you'll find it. Yeah.
Yeah, and I think you're touching on something there about when you talked about it earlier about how, the human condition sometimes that you're dealing with is a little tougher than obviously in a controlled environment in school. But I mean, I think it's safe to say people that go into the medical field, whether it's nursing or sonography or doctor or whatever it is, I feel like those people go into it because they really want to help people, right? Because otherwise it's a very tough profession to go into and work in every day if you're not in it for what I'm calling kind of the right reason, that humanitarian reason, the Hippocratic Oath, all that stuff, right? It feels like that's a special breed of person that goes into the medical field in a variety of different capacities.
I hope so, but then there's that time to time. Again, I've worked in schools for close to 20 years, and I actually do mock interviews with my students before sending them out. And I always ask them, why did you choose to be a sonographer? Because that's a question that's going to be asked at almost every interview that you go for. Like that, they're going to ask you. They're going to ask you, why should I hire you as opposed to somebody else? They're going to ask you, tell me a little bit about yourself. And they're going to ask you, why did you choose to be a sonographer? And the worst one I would say I heard is because my mom thought I would be an amazing sonographer. So there is that. It's a very small percentage, but I have seen that. Usually people say, yeah, I want to help people. Hey, I want to be a part of something. Yes. But there's that small percentage because my mom said so percentage. So we try to weed those out early into the program. But it does happen. It does happen sometimes.
That's funny. And then last thing, and I know you're so kind with your time. I appreciate you being here for so long. Once you're trained up on, say, whatever the latest technology is, how long before you have to get retrained again because the technology just keeps advancing the machinery and the stuff that you're working with?
So every medical profession, every nurse ever knows what CMEs or continuing medical education is. We as sonographers have to do the same, 30 CMEs every 3 years, which isn't huge. One CME or one continuing medical education credit equals to 1 hour of education. So it's really 30 hours. It's minimal. It really is minimal. You get your certificate, which you download to American Society of the. It's minimal. They talked about having a re-registry exam once every 10 years, but that hasn't happened yet in sonography.
Okay.
Yeah, they just talked about it, but it went away.
And once, I'm guessing, maybe I'm not right, but once you learn the basics of the machinery, even if they upgrade it, it's still, your way around the controls and you have a pretty good feel for it, right?
And also, fun fact, and I don't know if our listeners want to know, but if a hospital buys a piece of equipment that is new, let's say GE, I'm familiar with GE, Philips, anybody else, as that equipment comes, they will also get a application specialist that stays with that equipment for about a week. And every sonographer and staff spends a couple hours going over, pressing all the buttons. Then they give them a little certificate, which is worth 1 CME credit.
That's cool.
And that's how you get that education also. There's multiple ways. But they don't just sell equipment as, all right, it's kind of like last one. They actually invest the time. Again, the person that's training is a sonographer, which is another way to get a great job.
Sure.
As like application specialist. I looked into it myself. I think it's great. I think it's great that they're doing that. Yeah.
That is cool. So they don't just drop it off and say
Nope.
the instructions are in the box.
Nope.
Figure it out. Yeah. No, that's
YouTube
good.
it. Just YouTube it.
I know, right?
Yeah.
There's so many things you can figure out on YouTube nowadays, but hopefully not medical stuff.
No. They still, yeah. I mean, some get them for a day, but every person, every sonographer on staff should spend at least an hour pressing buttons, even doing they'll even go to the room, do the scan with you. Hey, and which is great. Yeah.
That is cool. Well, I can't thank you enough, Alex, and I'm hoping maybe you'll come back another time if we can catch you. I know you're busy.
We get some students in here, maybe a different
that
perspective.
would be cool. That would be really cool. Yeah, no,
I think it would be great.
That was really good. So thank you very much. Appreciate it.
Pleasure.
And I hope everybody watching enjoys the episode. Again, I'm Ed Masterson. I'm a certified life coach here in Santa Clarita. And I want to thank Mr. Fred Arnold. Fred created the podcast studio for us, and he allows us to be in here. And it's sponsored by 360 Executive Suites. Fred is a really good guy, isn't he?
Yeah.
He just is.
It's a pleasure. I love being here. Been here for a little bit, and I plan to stay. This is where we're going to be.
Good. I love that. And Fred's very generous in the community and helping everybody here in the building as well. So thank you all again. I'm going to play us out with this really cool music that we have, and then we hope you tune in the next time. And again, check out the contact slide here in a minute that we'll put up. And if you want to come take a look at any of Fred's 4 properties here in Santa Clarita to see if it suits your needs for an office or a business home away from home. Thanks, everybody. See you next time. Take care.